OK Sharon, so Mum's got everything organised. She's packed the bags, she's practised the journey, she knows where she's going. Now she's feeling that baby's on its way. Should she go straight to the maternity unit?
No, not straight away. What Mum should do is contact the maternity hospital by phone and speak with a midwife. The number can be found in the front of the handheld records, and it's a good idea for Mum to have this number on her mobile. It's important that Mum tells the midwife whether she's intending to give birth in the community maternity unit or in the labour ward. The midwife she speaks to will ask her some questions about her pregnancy, any previous pregnancies, how she's feeling, and will ask her to describe why she thinks she's in labour. That will let the midwife assess whether the mum is actually in labour or not quite yet.
Yes, it's better to know for sure rather than make the journey for no reason.
The advice might be to stay at home for now. Research has shown that this is the best environment for early labour. Use some simple painkillers, maybe have a warm bath, use some relaxation strategies, keep active and call back in a few hours. However, if the midwife thinks that labour has started, she would ask Mum to come to the maternity unit straight away and go to triage on the first floor. If Mum is booked to deliver in the community maternity unit, she will be asked to go directly there on the third floor. Mum should remember to bring their handheld records with them. If Mum has other children, they should make sure they have made suitable childcare arrangements before coming to hospital. There's no overnight accommodation for partners at the maternity hospital.
OK Sharon, so earlier we saw your journey to the maternity unit. Let's go back now and see what happens when you go inside.
So here I am at the Royal Alexandra Maternity Hospital, and the midwife has said it's time to come in. It's just a short walk through reception to the lifts, and you should make your way to triage on the first floor or the community maternity unit on the third floor, as you've been advised by the midwife when you made your telephone call. So let's go inside and meet Liane, who's going to take us up to triage.
OK Sharon, so here we are on our way to triage. Now in this hospital, the Royal Alexandra Hospital Maternity Unit, triage is on level 1, so when you get in the lift, just press 1.
Okay.
When you reach the door, it's important that you buzz for entry. The midwife will then know that you're here, she'll come out and let you in. Before she does that, it's important that you use some hand gel. In you come.
Thank you.
So Sharon, this is the triage area, and this is Dorothy Findlay. She's the senior charge midwife who's responsible for triage, labour ward and theatres, and she's going to continue the tour for you now.
Thank you very much, Liane. That's been helpful.
Hello Sharon.
Hi Dorothy.
It's lovely to see you. Sharon, I'm just going to get a colleague to show you maternity assessment where we assess the mums. It's just down there on your right, but when you come back I'll show you around labour suite.
OK, that'd be great. Thanks very much.
Hi there.
Hello, I'm Sharon.
Hi, I'm EA, the midwife. Can I just ask you to use the gel, please?
Certainly.
Thank you.
EA, Mum's arrived in maternity assessment. What's going to happen now?
Well, we're going to do a full clinical examination on the mum. We firstly will assess mum's well-being. We'll check her blood pressure, pulse, temperature, and we'll also palpate her abdomen to see which position the baby's lying in. We also assess the baby's well-being by listening to the heartbeat and recording it on a monitor. We also assess contractions, perform a vaginal examination to check the neck of the womb to make sure it's dilating.
So you build up a complete picture of what stage labour is at. What's going to happen now?
That depends on the assessment, of course. It could be that the mum isn't actually in established labour yet. In that case, we say to her, return home and provide her with some stronger painkillers to take with her. We would advise her to use some self-help measures, have a warm bath, keep active and use some relaxation techniques and wait for labour to become established. It may be decided that labour should be induced. We'd make a plan for that. Mum could go home and come back at the appropriate time. If the midwife thinks the mum is not quite in established labour, but it won't be long, or close monitoring is required, then the mum would be transferred to the antenatal ward for further assessment. Their birth partner can stay with them, but cannot remain overnight and would have to go home. In any case, the midwife will ensure she has got the contact details. And finally, if the assessment examination confirms that mum is in established labour, then she will be taken to labour suite.
You've used a phrase a couple of times, established labour. What exactly does that mean?
There are three things that establishes labour. There's a show, you can have waters breaking and contractions. Show is a plug of mucus which seals the opening of the cervix, and as the cervix begins to soften and prepare for labour, the plug of mucus is released. Show can be a single blob of jelly-like substance, or it can come away in small pieces over the course of several days. Show may not mean that you're in labour, as it can be several days between having a show and labour beginning. Water's breaking. The amniotic sac is a bag of fluid surrounding the baby. When the sac breaks, the fluid escapes, and this can happen suddenly in a large gush, or it can slowly trickle. If you think your waters have broken, then you should make contact with maternity assessment. And contractions. These will only show a sign that you are in labour if they are coming closer together and lasting longer than 40 seconds. When you feel them coming stronger, closer and more rhythmical, you should phone maternity assessment. Established labour is when the mum is having regular painful uterine contractions and when the cervix is dilated to 4 centimetres.
So the assessment tells the midwife that mum is in established labour. What's going to happen then?
Mum will be taken to labour suite.
OK, can we go and see the labour suite now?
Actually, my colleague is going to show you around labour suite.